Hi, Paul Sackis, Good News Broadcast, speaking to Dr. Gary Monheit. Hi, Doctor. How are you?
I'm fine. Very good.
Good. Associate Clinical Professor, Department of Dermatology, University of Alabama Medical Center. And we're going to talk about I guess it's called Sculptra Aesthetic. Effectively corrects Nasolabial. I don't know if I did well on that.
Close.
Close? How would you pronounce it, Doctor?
Nasolabial.
All righty, folds, all right, and other facial wrinkles. So what is that word, folds? What does that mean?
Okay. Well, that is the groove that appears between the cheek and the mouth. And it is a sign of volume loss and aging as that groove starts to appear. And, it's called a prominent wrinkle line. It's been called a smile line, and even been called an parentheses. And just basically, it's a sign that the cheek skin is descending and starting to age.
Okay. Now, this Sculptra Aesthetic is able to cure that, to stop that from, having those types of lines in a person's face?
Yes. Sculptra, as well as other soft tissue filling agents, are able to add volume back into the area where the groove or the wrinkle depression is. Sculptra is kind of unique because it is what we call a stimulatory filler, in that it's not just injecting a volume in that will go away, but the poly-lactic acid chemical that makes Sculptra actually causes new collagen to develop by stimulating the cells that make collagen, the fibroblasts.
Okay. Now, would this apply, let's say, the crow's feet or between the eyebrows, things like that?
There are other areas it can be used off-label. It usually isn't used in those areas, but for example, it can be used in depressions in the cheeks, depressions over the cheekbones, and generally what we call panfacial filling, or to fill up the areas in the face that have lost volume. And what we found is that as you put the volume back that has been lost, there's a lifting phenomena that occurs. You can think of it as a beach ball that slowly starts to deflate, and as it deflates, it falls to the ground. Mm-hmm. As we put volume back in, we lift it back up. So facial features, as we fill areas such as the cheeks, the chin, and the nasolabial folds, as we fill those, we also cause things like jowls and sagging skin to raise back up again.
Now, does that affect, when you say jowls, many older people underneath their, in their neck area, the skin becomes not as strong looking. Does it start first at your face and work its way down?
Well, there is degeneration of skin and loss in tissue all over the body.
Okay.
We're prominently looking at the face. And the reason why the nasolabial folds have been used to study it for approval as a cosmetic stimulatory filling agent is that this has been used as a measuring stick for all other fillers over the years. The first filler was collagen, and then hyaluronic acids were used. So in this particular study, Sculptra was randomized against collagen, which was the filling substance of choice at that time. Randomized in that one patient received collagen in the folds, another patient received Sculptra, and they were injected to achieve what we call maximal improvement until the folds were back to a youthful, normal appearance. Then over a period of time, they were followed, and this was over a period of 13 months to see first how long each of them lasted, and then at the end of that, an added extended period was used to follow Sculptra. The collagen itself lasted about 3 to 4 months, but Sculptra still had a major improvement in appearance at the period of 13 months.
Okay. Now you said in addition to looking, in essence, your skin healthier, younger looking, it would actually help to revitalize the skin?
I don't think I said that.
Not revitalize,
but there
it would.
actually is, because it stimulates new collagen under the skin.
Okay, right.
There really is a textural change we see in the skin when Sculptra is used. So it will, by volume, fill up areas, but it does make the skin look a little better.
So if someone's, had, let's say if someone had, bad complexion growing up, say they had pimples or their skin isn't, smoothie, like a little baby, is this something that somebody could possibly inject in different parts of the face?
No, it's actually not used for that.
Okay.
This is a stimulatory filling agent to build collagen under the skin, which rather than the surface of the skin, which is what you're talking about,
okay,
texture and surface, what we're talking about is the foundation of the skin, the structure that supports the skin. And the difference between this and other fillers is that this actually stimulates the body to make more of its own collagen to build up that structure.
Sounds like good news.
Yeah. It takes anywhere from 3 to 5 injection sessions, but the fact that it lasts for up to 2 years in some patients gives it a reason why it's worth the injection sessions and what you're doing for it.
Now I see here you have a website that I'm looking at, Sculptra Aesthetic, and how it does, where in the face, photos before and after. Welcome to the new age of anti-age, okay? Sounds good here. So there's some information here as well on your website. And you have a website as well, or is that so, Doctor?
Yes, we do.
And what's that?
The website is called Total Skin and Beauty, and it's just the website of our particular practice, and it's a full comprehensive dermatology practice with emphasis on cosmetic dermatology, photoaging, and the correction of these things.
Over the years, more and more people are, you think, desiring to have their skin, look more young and healthy?
Yes, and one of the reasons why is that we've taken a lot of the trauma, the downtime, and the risk out of facial rejuvenation. Injectable fillers, the use of Botox or botulinum toxins, and some of our other cosmeceuticals and lasers have really made the practice of rejuvenation easier, safer, less downtime, and to fit in with one's schedule in life. So those are, I think, the reasons why things have become more popular.
Well, that's
in
good.
addition, us baby boomers never want to get old.
That sounds good. There's nothing wrong with that. As long as we're healthy, they say, right?
Exactly.
All right. Well, fantastic. Thank you very much for sharing this good news with us, and we'll send our community over to the site and for them to look into it and see if it works for them.
Oh, it's been great talking.
All right. Thank you, Doctor. Thank you very much.
Sure. Bye-bye now.